Good morning, everyone. Welcome in on this Thursday to our morning media briefing. You may notice I am not Dr. Steve Stites. I am, however, Jessica Lovell. I'm a journalist here at the University of Kansas Health System inside our media relations department. Dr. Stites is on a much needed, probably a much too short vacation for a couple of days. So he's letting me hang out here with all of you. So I appreciate you letting me hang out. And I will warn you, I do not have a medical background. I do not have a clinical background of any sorts, which is why I'm so grateful that Dr. Stephen Lauer is joining me this morning. He is an awesome guy, great pediatrician here with us, my kid's pediatrician. How are you this morning?
Doing great, thank you.
So we are going to be talking about traveling with kids. Oh, help me. So I'll have a lot of questions for you about that. And lots of other stuff about kids, looming school, sports. It's summertime, so
yes,
we'll talk with you in just a moment. Okay. Also on kind of a vacation is Dr. Dana Hawkinson joining us. Are you in an undisclosed location, or can you share with us where you are?
Well, I'm in Florida at a beach, so. But well, I've tried to produce pictures showing physical distancing, and so that's extremely important.
Well, I hope it feels like a vacation. I think we've bothered you every hour on the hour since you've left on Tuesday. So we appreciate you hanging out with us a little bit on your vacation. Before we get to some of those things that you're seeing out there while you've been on the road and in a plane and out on the beach, tell us about the numbers this morning. What are they telling us?
Yeah, it's pretty scary. You know, I also saw a recent article on CNN that the Arizona is sent out a letter to their hospitals to prepare for a surge. We certainly know that at KU Health System at the hospital, for the past week, we have certainly seen an increase in patients, which is really concerning. We were down to 9 or 10 patients. Over the last couple of days, it has gone up. We currently have 18 patients in-house. 8 of those are requiring critical care services, so ICU, and 3 of those patients are on the vents. Overall, we've also seen an increase in the number of cases in Kansas as well for the past few days, so it's certainly concerning.
Which is why we have to do everything right as people are starting to get out, socialize, travel. You left on Tuesday. You jumped in the car, headed out to the airport, jumped on a plane, landed in Florida. Were you impressed with what you saw, or still a little concerned?
Yeah, certainly. You know, again, at the airport, 50-60% of people had face masks on, which is important. There were a lot of hand alcohol gel or sanitizing stations, which is good as well. I think that was really good. In the planes, 80 to 90% of people, there were a couple of people who still didn't wear masks. So I think that is very good and encouraging. Most people did try to maintain physical distance as well. And that's very encouraging. I think we still need to continue to get out the message and the education, because as summer opens up, the restrictions have lessened now. More and more states and communities are opening up. There will be more travel, and that is just going to add to the ability for the virus to spread.
Okay, I want to show a video, because while you were out there, you were kind of our video journalist and kind of gave us a behind-the-scenes look at how you were traveling and how you were doing it right. So I want to show that, and when we come back from this quick video, I want to talk about what you're seeing out there on your vacation.
Okay.
And as you can see, I haven't touched my hands, my face coming into the airport, and right now I'm wearing glasses. So obviously we're here in the airport now, and we're able to be physically distanced because there aren't that many people in the airport. But if we can do that, that's better. I've obviously taken off my sunglasses. They offer a little bit of protection, but as we'll see later on, it's really not considered eye protection by healthcare standards. So right now we are just gonna be sitting here with our masks, physically distancing, and waiting to board the plane. So we're on the plane now, and I have my alcohol gel, and I will be doing it right after this. I made certain not to touch anything on the plane while getting on as much as possible. The other thing is I do have my eye protection. Some of you are asking about if I have better protection because I work in the hospital. No, these were bought by a colleague who bought them at a hardware store. Again, they have side and top protection. Even Dr. Stites said he ordered his off of Amazon. So any type of eye protection is going to be good. We've always said that Eyeglasses don't really constitute as eye protection in the hospital, but if that's all you have, or eyeglasses or large sunglasses, that may help as well. Otherwise, certainly, again, we've talked about going to the hardware store or even ordering them on Amazon.
All right, so Dr. Hawkinson's joining us from his vacation in Florida. You've had a day or so to actually enjoy your vacation, get out to the beach. What are you seeing?
Yeah, so it was really good. Again, there aren't a lot of people traveling. There are people who are continuing to travel, though. It was very easy to be physically and socially distanced at the beach. Obviously, it's a large area. It's not confined. It is outdoors. That is something that we have always talked about from day one, is really the distance from other people. Even in the spring break images, which we saw, I think that, there were people out at the beaches. As long as you can be separated, probably a lot of those infections that occurred during spring break with the college kids probably occurred in the evenings, at the house parties, at the bars, things of that nature. Again, even at the Lake of the Ozarks, Dr. Stites and I have always promoted being outdoors. If you can be outdoors on the lake, away from other people, that's still going to be a good thing. It's really when you get into the confined spaces in other areas, even if you're outside with a large congregation of people, that you're going to have the highest risk of virus infection to other people.
Well, no doubt we'll have a lot of traveling questions this morning, so hang with us. We'll get back with you in just a moment. Dr. Hawkinson, thank you. I want to turn now to Dr. Stephen Lauer. Again, thanks so much, kind of holding my hands a little bit today. You've done this a few times, so thanks for being with us. But I want to talk to you a little bit about, because we talk about traveling with kids, but there's so much more when it comes to kids. We're in the middle of summer. We've got school looming, sports. What's your message today?
Well, just to echo what Dr. Hawkinson was saying, the numbers are going up. We just see this every day as things opened up. This is the prediction of what was going to happen. And so I think people are just going to have to continue to be aware that the pandemic continues. There are risks that didn't exist last year with all of these activities. And you just have to be thinking about these carefully. How do you protect yourself, your child, the rest of your family, and what's the risk-benefit analysis of all these things?
So behavior is everything.
Absolutely.
All right. So we're going to open up to the media. Is there any media questions this morning? No, none. That means Jill's up. Jill, do we have some questions from our audience?
Sure. Allie wants to know, what about public restrooms? Is a virus in the air after the toilets flush?
Dr. Hawkinson, we're looking right at you. And I know you were in you had the pleasure of going to the restroom in the airport the other day. So
Right.
your thoughts on that?
I did use the restroom. I did wash my hands afterwards. So we do understand, and these are from studies from patients who have been infected with coronavirus that they looked at University of Nebraska Med Center, but other studies as well, where you can see that there is shedding in stool, and people can detect the virus in stool. Certainly, whenever you have a toilet flushing, they can aerosolize bacteria, viruses, things of that nature just from the toilet flushing itself. That's why toilet covers are good for that. Again, I wouldn't be too concerned, though, once a toilet is flushed, that it would just be in the air. There's been no documented cases occurring because of that. I think, again, more importantly, it's going to be hand hygiene before use, after use, and then continue to stay out of that confined space as much as you can during that time. But certainly causing infection using the public restrooms shouldn't be otherwise too much of a concern.
I would imagine you echo that.
Yes.
What he said. All right.
Yes.
Jill, do you have another question?
Yeah, on a follow-up to that, Jean asks, in the public restrooms, are the hand blow dryers safe? Because it's blowing
Yeah.
out.
Yeah. Good question.
I think that, again, there's, as far as I'm aware, there are not any studies that get at that. The aerosolizing part of this is, I think, would be hard to get at there. But the message goes back to what is it safer to use paper than do the blowers, perhaps. But if you're wearing your mask, washing your hands regularly, there's probably better things to be worrying about, I think.
Another question.
The other thing, sorry.
Go ahead.
The important thing to note is that, you're probably going to be using the hand blow dryers after you've washed your hands. Certainly, again, to Dr. Lauer's point, there's a lot of debate, or there have been different publications looking at paper towel use versus hand dryer, blow dryer use. I don't think we need to get into that here. I don't think it's that significant or important. The important thing is you're using the soap and water to adequately wash your hands.
All right, Holly is asking, what recommendations do you have for international travel with kids, keeping their masks and their eye protection on for hours? How are you going to do that, Dr. Lauer?
Well, right now, international travel is going to be a big problem anyway. That might be a while before you really have to worry about that. So just the question of how do you keep those masks on kids in general under the age of 2, we know the recommendation is not even to try that because it's just not going to work. It's still the same ones, the distancing, keeping their hands clean, frequent hand washing, if possible, having the face mask on them is going to be the ongoing recommendation. It does become a problem if you're going to be talking about traveling, and it's something for families to consider in the whole package of thinking about this is how are you physically going to get there with your kids while trying to follow these rules that you know are important to keep them safe.
Well, my follow-up question to that is actually to both of you, and I know I'm going to have to end up taking both of your advice, so I don't know what your answer is going to be, but I want to travel with my kids, 4 and 7. The question, is it safe? I mean, they're great travelers. I give them like an 8 or a 9. Listening, I give them like a solid 5. So the idea that they would keep their hands away from their face, I don't know, is it safe or do I hold off? Dana?
Well, I think you can try everything you can to mitigate the risk. I agree with Dr. Lauer. He would know better than I would. However, it is going to be difficult to keep a mask on a child. Even if it's on, it's going to be difficult for them to avoid touching it. You know, we understand that, and I had concerns that the plane flight itself was probably going to be the most risky. So international flight, as Dr. Lauer talked about, is probably going to be very difficult. Even if you can go travel internationally in regards to the U.S. or the State Department standards. But that long on time in an airplane, you are probably just going to increase your risk exponentially. So can it be safe? I think you can work on making it safe. Are the children going to be able to maintain proper hand hygiene and not touching their face? That's probably going to be a little bit more of a question. And I think you need to assess your children and the risk and the benefit of traveling in that way.
I'd say I think people need to think about where they're going. We know we're not going to be going as far. So how can we stay more local, stay in places that aren't as busy? How you're going to get there, you know, going by plane versus driving if you are going to travel is something people have to think about. Who you're going to see. If you're going to go see family and some of those family members are at risk, you know, grandparents, things like that, I think we really need to consider how important it is. And then coming back, you know, if you're coming back right now from certain parts of the country per the Kansas KDHE recommendations, you may need to be in quarantine. And those hot spots may be changing even while you're gone this summer as the numbers go up. So I think there's a lot that has to go into that idea of travel, really thinking carefully about it. But if, you know, within certain guidelines, I think it can be done relatively safely. But there's no such thing as no risk.
Yeah, that's a good point. Jill?
Yes, Miss Cantu has a brother who's in Mexico. His name is Angel, and he's a geriatrician, works, and he is asking about pentoxifylline medication. I probably butchered that name. I do believe from asking Dr. Lauer prior to the broadcast that it's a blood thinner. Is that a good treatment? What other treatments are out there?
Well, I'm a pediatrician, so I'm going to.
Dana?
I don't know that medication specifically. I would just say in general, I don't think the general rules, we'll just keep going back to it. Face masks, hand washing, social distancing are the things that we know make a difference. Anything else, I think, is really speculative.
Yeah, I agree. We have to remember there's no, really, besides remdesivir, there's no proven prophylactic or treatment drug for COVID-19. I would absolutely recommend against using that. I would continue to look at other studies or clinical trials that are ongoing. But we've seen a lot of different drugs, which we have for other purposes, for other disease states or other reasons that people can take those drugs that people have been trying to repurpose for COVID-19. I think that's all and well and good, but I think it needs to be done in the context of a clinical trial. As far as pentoxafolin, specifically, I would recommend against using that. There's absolutely no data suggesting that it helps. I think you were more at risk of side effects or problems from taking that.
Dr. Hawkinson, I had a question that actually came in yesterday that I thought was a good one. It was, if you were over 60, which we know you're not, if you were over 60 and had any type of underlying health condition, would you still be taking the trip that you're on?
Yeah, that's difficult. I think that, again, we have to assess risk. I'm concerned if I get COVID. I think that anybody that gets COVID, no matter their age, although you have a higher propensity or probability of complications as you get older, above 50, above 60, above 70, of course. But we do understand that even young people can get severe illness. They can get the inflammatory dysregulation, the cytokine storm. They can get the blood clots in their arteries, in their lungs. And so it's really rolling the dice. If you do get COVID, is it more likely than not that should I get it at my age that I will be okay? Yeah, but it is still rolling the dice. I did want my parents to come down last weekend. They were still very concerned about traveling. They're a little bit older than 60, but I think that needs to go to everybody's understanding of what is their risk. And we try to continue to put out, again, good educational messages about that and let everybody decide, but giving everybody the information that they want to decide. So it's really hard to say, again, doing the correct things, the non-pharmaceutical interventions, the physical distancing, the face masks, the adequate hand hygiene and not touching your face, you are going to significantly lower the risk of getting COVID-19. We know that you can get it in Kansas City as well. We know that it's there. It's in other places as well. So that's a hard question to answer. As far as would I, if I was 60, again, I think it would just have to be during that time, but I would have to understand and know what to do to try and reduce my risk as much as possible.
Jill, do you have another question?
A lot. Several people are asking, I'm going to lump several people together. They want to know about the hotel room, how safe you feel, everything from the pillows on the bed. Did you take your own pillowcases to just the high touch surfaces? If you're letting the maid service come in, those kind of things, Dr. Hawkinson.
So I've tried to go, with my children before. We stayed in a place, this was a few years ago, for 6 or 7 days at a time. That's a little bit difficult staying in one place. So right now I'm at a VRBO. Later we'll be moving to a hotel. I don't have a problem with that. Again, the hotel industry has put in a lot of measures to help protect its clients, has been uber thoughtful in trying to clean surfaces and rooms. The same thing goes with other vacation rentals. Areas are cleaned. Any household common household cleaner, for the most part, is going to have activity against COVID-19. I did not bring my own pillowcases or anything like that. I otherwise feel safe. We understand that the virus can live on surfaces, but as time goes out from when they were deposited on the surfaces, either by a cough or sneeze or touching, that viral load will decrease and the virus will break down. So to answer the question in a quick way, I was not really concerned for those reasons.
Dr. Lauer, a couple of questions. Jessica asked, and Michelle asked, is lake water at risk for kids to swim in? And what are you thinking about all the teens now descending onto the community pools in their neighborhoods?
Well, I don't think lake water is any more risk this year than it was last year. Let's put it that way. So
Okay.
I think it's there's always a question of what's in any.
You're right. I get
in water,
your
but,
drift.
In general, probably not a big risk. From what I understand, studies so far indicate as to the community pools that chlorinated water that's in the pools is pretty effective at killing the virus, and so shouldn't be, in terms of the water being a vector for spreading the virus, should not be a big deal. The concentration of people in the
Yes.
pools, if you're still standing next to somebody in the water
Right.
less than 6 feet, that's a problem.
Comes down to social
And
distancing.
that's going to be,
at that
that'll
point.
be the worry. The actual transmission by the water should not be the real thing that we're focusing on.
Jill, question?
Yes, Allie Nicole wants to know, Dr. Lowry, what do you think about schools? What is the risk to the kids, risk to the staff? And she points out that Israel closed after 2 weeks of reopening.
Right. So again, this will be an ongoing process. Whatever is decided and thought at the beginning could change dramatically depending upon our societal response on many fronts. But I think we do have to keep in mind that we know not being in school is a known risk for kids. And some of the thoughts now about the educational loss that occurred while the schools were closed is really significant. Estimates that in some settings, kids lost up to basically the whole year of education. And especially in some of the school districts, kids at lower socioeconomic status, that is truly significant loss. So there's that risk of them not being in school as well. As for getting them back, the same, well, you'll just keep hearing the same messages. How do you socially distance? How do you work with hand washing, if possible, depending on their age, the masks? And how do you go about an educational process that respects the danger of this virus while addressing the educational needs of the kids? There's a lot going on about that, lots of different solutions being tried around the world right now and in our country. And I think we're just going to have to take a look at all those and figure out how to get kids safely back into some kind of educational system that gets them into school as we get closer to August.
So it's June, and assuming schools open and sports gets back up and
Yep.
running at full capacity, what do you want people to know heading through the next couple of months?
Well, one, we want the normal things to continue, which is get back into your pediatrician or family medicine provider to have the school physicals done, the sports physicals done. Those are still all, the requirements remain the same. We know that around the world and in the U.S., there's been a dramatic drop in vaccination rates as people have justifiably stayed away from the doctor's office. We have to correct that and get everybody caught up. One of the worst things I can think of happening from this pandemic is a resurgence of those vaccine-preventable diseases, measles, pertussis, H-flu meningitis. All these things are still out there. Polio is still active in the world, and the only way to protect against those is keep the herd immunity levels up with vaccination.
Jill?
Alex writes, will someone who was asymptomatic and tested positive develop antigens and be able to donate plasma for COVID-19 patients? Asymptomatic.
Dr. Hawkinson?
Yeah, you should still be able to develop antibodies. The thing to do is contact community blood center, talk with them. But if you've had the infection, your body has seen it, your immune system has seen it, has directed a response to it. One of those responses will be antibodies. You should still have antibodies produced and still be able to donate plasma.
All right. Barbara asks, what about saltwater pools? What's your thoughts on that? Are those safe? I think she's comparing perhaps
For dechlorinated.
Yeah.
I'm not aware of anything specific on that, but again, the general rule is the solution to pollution is dilution, and so the more things are spread out, I think it's going to be much more important to think about how close people are together in any of these settings than that actual setting. The water itself, I don't think is going to be a problem. It's going to be how close are you to people when you're in the pool.
Can we steal that phrase from you? I really
Oh, no,
like
that's
it.
an old, that's
The
an old,
solution-
that's an old
me.
Navy one.
Solution
That's
to
from
pollution is dilution. Okay, I like that.
That's the Navy.
Hey, Dr. Hawkinson, this is a question from Joanne. Do you think the airlines are cleaning enough? Should I take my own wipes?
Yeah. Yeah, that's hard to say. I don't know exactly their practices. They certainly promote a lot of practice, such as wiping down or spraying down seats. Again, I think that you have to assume that the virus is everywhere. I know that when I was traveling, I was very cognizant and tried to be hyper aware that the virus could be anywhere. And so I'm doing those things myself. I am taking responsibility. I am trying not to touch high touch surfaces. I have hand gel or alcohol sanitizer. I do have wipes. I didn't have them with me in my carry-on, but certainly I brought my own Clorox wipes in my checked baggage. So I'm doing all of those things. I'm trying to maintain and be away from people. I have my mask and my eye protection. I'm doing all those things individually. I know that the industry has promoted and talked about things they are doing. I think that's all well and good. The employees are all wearing masks, so they are doing as much as they possibly can. And then it just kind of but you can't control for that. The only thing you can control for is what you do. So if you can continue to do those things that we've talked about, you are going to reduce the risk to yourself and your family as much as you can.
Jill, question?
Vanessa, she says, I work with newborns as a private practice, and she puts in parentheses, in home. Wondering what advice you have been giving to your new families. Can baby go to the grocery store, meet relatives? Can big siblings go to preschool? Mom's day out, can they travel?
Okay, so for newborns, to me, the advice has not changed from what it was last year and the year before. Newborns don't need to be around people who are contagious with influenza, cold virus, or coronavirus. So I really think it's another form of social distancing. Keep your baby away from those who could be sick, and especially in that neonatal phase. As they get older, I think it's the same things. That the studies do seem to suggest overall that children are less severely affected as a group by this disease. That does not mean the risk is zero, and certainly some children have become very ill and some have died. Overall, probably not as sick. But again, their siblings going out and going to school and then coming back is the way things get spread. And some studies seem to suggest that child-to-child transmission is less in this disease than it is in, say, influenza. But we don't really understand this completely at all in any way right now. So that's an evolving story. So it just keeps cycling back to these same rules.
Right.
Can you keep everybody as clean as you can? Can you get their hands washed? For those who are at risk and or the younger kids, keeping them away from the sources of the virus if at all possible.
Well, there's a lot of pressure from parents. I have young kids, and they were out of school, so now you want them to be around their friends. My daughter had a little friend over the other day, and she sneezed, and my eyes got big as donuts. Where it wasn't bless you, it was, oh gosh, where have you been? And it's just kind of socially we're trying to adapt to how we're socializing our kids again.
Again, I think much of and it's great, and parents should be most concerned about how their kids are doing. I worry as much about who those kids who probably are going to do okay if they do get the infection. Who are they going to be around? Who might they be spreading it to? It's this whole web of spreading of the virus and trying to contain that spread that we really have to be cognizant of. And so the reality is we're going to have this period until we get to some kind of herd immunity we have to think about how wide that web of interactions is.
Right.
And how do we contain it? What's the level of, if not full quarantine, what's our level of self-regulation?
It's like dabbling in it, and then we kind of pull ourselves back a little bit.
And we'll see, as Dr. Hawkinson mentioned, every day now the numbers are going up. How is that going to continue? How do we kind of expand, contract? How are we going to go back and forth on this over the next months?
Jill?
Donna writes, the educational loss breaks my heart. I have seen that some European schools are trying plexiglass barriers between desks. Would that be effective?
Well, again, there's no studies on this, and I'll defer to Dr. Hawkinson, but I think we just have to, we're going to see a lot of these kinds of efforts. What can we be doing? What might work? And it's that balance of what's the value of being there if you're actually in a box? We're going to have to kind of figure those things out and then see how that really plays out. If the kids are back in school and infections start spreading rapidly, we're going to have to reconsider.
Virginia wants to know, do you recommend antibody testing for young athletes prior to implementing a conditioning routine?
Yeah.
So antibody testing, we have to understand, we don't really know how to use it on the individual level yet, other than, say, for somebody who wants to donate plasma. We do understand, and there has been a position paper by some of the cardiology groups that certainly would advocate for antibody testing because we know infection with COVID can have some effects on the heart. So we'd be asking that specific question and that reason for doing the antibody testing themselves. So we do that. If your antibody's positive, you would just have an EKG and an evaluation by a cardiologist. So answering that specific question, again, for people like college athletes and stuff, that has been proposed. We may be doing that. For all other athletes or for younger athletes, it's really hard to say whether that should be done, and that should be part of our dogma in anyone who has possibly come into contact with COVID-19 to see if you have antibodies against it. So that question is not fully answered, but we do understand that for answering this one question, we should test these athletes and then look, have a cardiology evaluation because we know that there can be effects on the heart. We are doing that, but I think that is still something that is not fully answered. And as we move forward, we will start to learn more about really what is the post-infectious evaluation we need to take for athletes, for other people in general.
Dr. Lauer, Allie wants to know, are kids with asthma more at risk for COVID-19?
I think asthma would count as one of the comorbidities that make us more concerned for them being at additional risk. So certainly one of the conditions to keep in mind. When we ask about comorbidities, that would be one to keep in mind as putting you at risk.
So what would a parent know to look for if they needed to come in and see you?
It's, well, the same ones as if their kid, they should be familiar enough with their child's asthma to begin with. If they're coughing more at night, if they are having problems with just getting around, if they seem short of breath, if they're using or asking for their albuterol inhaler more often. But those are the same ones, the same reasons we'd want to see them anyway.
Got it. Jill?
All right, Anne and Tracy are wanting to know what we know about our patients that are hospitalized, age ranges, if they have comorbidities, and if our numbers, if the other hospitals, if they're going up. Do we have any information on that?
Dr. Hawkinson?
So I can only speak to the patients that I've seen with COVID-19. We've had many more in the hospital. I don't think we have a specific database that we know. I don't have access to that. I know that we have seen younger patients who've come in and been critically ill and had death and mortality. But I've also known that I've seen an 80-year-old woman who was on the ventilator for about a week or 10 days and who came off the ventilator and survived. So we do know that there is a broad age range of people that we see in the hospital who have mild illness to moderate illness to critical illness. There's obviously the propensity would be older age and certainly comorbidities. I don't have otherwise access to the full numbers of what KU has had, but we know there is an age range.
And as far as I'm aware, there have not been anybody any patients in the pediatric range under 18 who have been in our hospital and seriously ill. So it shifts towards older people, but certainly people in their 30s, 40s have been in the hospital and very ill.
Jessica wants to know, what about when kids have innocent heart murmurs? Are heart murmurs innocent?
Yes. So the critical word there is innocent, and the children's hearts make lots of noises. And I don't know exact number, but it's a very common finding. There's lots of kids who have murmurs that are just the sounds of their hearts make, and they are innocent. They have no pathology associated with them. If in talking with your pediatrician or family medicine physician, they think there's a potential problem, always a check-in with the pediatric cardiologist to confirm that is a reasonable thing and is what we always do.
What age range is that, those innocent murmurs?
It can be any age. I mean, it's much
Really?
more common in the younger they are. So, a lot of comes up a lot in the kindergarten or first grade physicals where there's just a small murmur, an innocent murmur, but we can always check that out if somebody's worried about it.
All right, good to know.
Yeah, and Fonda is asking about protection or precautions while in the gym.
Dr. Hawkinson, have you hit the gym yet?
No, I need to. This is very important, but this goes to any gym or say yoga studio, Pilates studio, even church. Anytime you're having a confined space, I think you have to be aware of the setting, aware of the situation and the space itself. You may want to bring, just as traveling, you may want to bring your own hand sanitizer or alcohol spray or wipes. I think a lot of the gyms are providing those for their clients, but I think it's important that protect yourself as much as possible. You don't know, maybe it'll be out, maybe they can't get any more wipes or spray. Do those things. If you are thinking about being in a class, understand how big that class area is. Are they going to be able to do it outside? Are they doing it in a big area, a small area? Those are things that you have to consider. If you're going to be, in close proximity to somebody for 30 to 40 minutes to an hour, I think it's a little bit more dangerous, especially as people are working out. They will probably be breathing harder. If they have infection, they certainly could have be expelling more virus because they are breathing harder and working harder. So those are things that you have to consider, and taking those little details into account, then you can plan for what to do in going to the gym. Certainly, frequent hand hygiene and absolutely not touching your face is important. And of course, wearing a mask. It's going to be difficult to wear a mask if you're on the elliptical or on the treadmill or doing your class. But if you're doing other things such as weights or stretching, it may be more reasonable to wear a mask.
Dr. Hawkinson, I have one last travel question. I'm asking you to look down the road a little bit, and it has to do with weddings. Jane asked, she said, I have a wedding in Mexico in December. What do you think the COVID story is going to look like then? Do you think it's going to be safe to go? I know people have trips planned and they want to be able to crystal ball look in the future, but what do you say to Jane?
Yeah, this is very important. So I would like to say that, me traveling now, we have to look at what time point are you traveling. So it was probably safer for me to travel 2 or 3 weeks ago or a month ago because we know there were less cases. We know that there were less people in the airports and on the flights. Now, fast forward to 2, 3, 4 weeks, 2 months from now, it's probably going to be more dangerous to travel. There will probably be more cases out there. We don't know. This is a crystal ball. I think it's also important to understand and know what state you live in so that you can look at your state health department if there's any quarantine. We know for Kansas there is. I don't believe there's a state quarantine for Missouri if you're coming in from other places. So that's important to note as well. I would be very cautious about traveling outside the United States at this point in time, even for the foreseeable future. Say even into December, I think will be very dangerous. We see stories every day about other countries, including Central and South America, which are being hit very hard by this disease right now. So I think that's a concern. But I think you just have to watch as you move forward in time, what is that area going to be like? Again, I've talked about going to the local or the state health departments and maybe looking at even the county or city level of the incidence of COVID-19, although that's not the best and most up to date. That is the only information you have. And if it's a lower area, you may have a little bit better chances of being able to go there. But if it's a hot spot, you certainly want to avoid it. And you just have to continue to watch the news and watch statistics daily as you move further into this pandemic and into the summer and you get closer to your trip.
Dr. Lauer, do you have any trips planned anytime soon, or what are your thoughts about you traveling?
I'm hoping to, but again, I think it's very difficult to predict because the rapid change in the situation, the numbers changing. So, yeah, I mean, December and outside of the country, I think if you had to bet now, I'd be saying that's really dicey. Everybody's going to have to pay attention, and it's to the numbers, how things are going, and I expect to see some expansion and then some contraction around certain areas, certainly of how to travel and is it safe or not.
Jill, did you have a final question?
Yeah, a final question comes from Tiffany. She says, with baseball and softball starting up again, do you recommend the players, coaches, and umpires wear masks on the field and in the dugout?
Well, again, this is all speculation in a way because there's no real studies on this. I think the dugout is certainly a much more concerning area. That's where you have people close together for extended periods of time. I think it would be a reasonable one to say yes in the dugout. On the field, you're generally by yourself, hopefully not in close contact, maybe less of an issue there, but and certainly if you're playing and actively involved in a sport, keeping masks on is more challenging. I think in the dugout is a pretty reasonable idea. Again, most of at these games, youth sports as they go forward, I'm as much concerned about the parents and the crowds around them and how they're behaving as the kids on the field.
Yeah, sports are heating up. I've watched people post all their kids back in baseball on Facebook, and they're excited. So,
and I want families to be really cognizant of how the groups that are running these events are setting them up. It's just like travel. Do they have the arenas set up and the gyms set up the right way? Are people spaced? Are there proper precautions around? So I think they really have to pay attention to that as well.
And just final thoughts on, as we head out of here today, we want to hear kind of what your message is to the community.
The pandemic's still there. We know that the non-pharmaceutical, pharmacologic interventions of hand washing, face masks, social distancing have a positive effect. We're going to have to pay close attention to how the pandemic numbers go up and down and make some really difficult choices based on the risk to our families.
Dana, before you hit the beach, do you have some final thoughts?
No, I'm going to be doing literature reviews. There's a lot I have to look up now about COVID and asthma and traveling and all that kind of stuff. So I'll probably be in reading all day. I'm not having too much fun. But again, people we know that they're going to be traveling. We know that there are plans. We are trying to set you up with the best information to protect yourself. As you move further into this, and again, we get closer to your travel time, just understand the risks, understand where you live, and if there are travel restrictions, continue to maintain your physical distancing, your mask wearing, your adequate hand hygiene, and those are going to be things that you can do to significantly reduce your risk of getting COVID.
All right, Dana, thanks so much for joining us. We'll see you bright and early tomorrow morning, though, okay? One last time this week.
All right.
Thanks. And Dr. Lauer, thanks so much for joining us. A lot of great information.
Glad to be here.
Yeah, thank you. Thanks for doing this with me on my first day. So I just, in wrapping up the show, we want to just let everybody know how much we appreciate them sending in their questions and just the interaction that you've given us with our show, and lots of thumbs up and hearts and all your questions. But now we want to take it a bit further. We want to see your faces. So we're asking you to show us pictures of how you're out in the community playing it safe, whether it be on the baseball field, whether it be traveling or trying to socially gather safely with your friends. It matters now more than ever to make sure that you're staying safe. So maybe you have some good ideas, but we want you to send those in. We're going to put a website up to Medical News Network at kumc.edu. That's our email address. Email those to us, and then we will show them on our show. So again, we want to see your faces. And then tomorrow's show, I'll be back tomorrow. Dr. Seitz will be here on Monday, but we've got emergency medicine physician Dr. David Lisbon is going to join us, and also the executive director of Vibrant Health, Patrick Sally, is going to be here to talk about the changes they're seeing with patients that they serve with COVID-19 fatigue. That's something that we're hearing a lot about. It's starting to set in, and summer is here, the weather's changing, and then of course you add the unrest and the protests that we have seen across the country. So a really interesting topic tomorrow that we're going to talk about. And finally, as we close out this morning, Dr. Stites is certainly gone, but not forgotten. And of course, we will let him have the final word. Have a wonderful day.
The pillars of infection control don't change. They've kept us safe. We've done a great job here in Kansas City. So just remember until we gather again that there's still no place like home.